possible future problems that can happen down the road. Most importantly, for people, I get a lot of questions about hair loss that generally with gastric bypass happens somewhere between a half a year and a year out from surgery. For women, their hair can get very thin. For guys too, but women seem to be more concerned about it. Usually it comes back between 12 and 18 months and just as full as it ever was. People talk about protein being an issue, but even people who have perfect protein intake often will have some degree of hair loss. People can get kidney stones, as we mentioned, with dehydration, especially after gastric bypass. With weight loss, gallstones can form. About 25% of women in America need their gallbladder out at some point during their life regardless, and with weight loss that number definitely goes up. There is a medication that you can take that will minimize the formation of gallstones. However, it's fairly expensive and difficult to take. Most people end up not taking it. It only decreases the amount of gallbladder surgery by a very small amount too. So most people who are taking that medication don't actually get a benefit. So we don't offer it routinely. It certainly does help prevent a few gallbladder operations, but not most of them. People ask why we don't take the gallbladder out at the exact same time as we do the surgery. For the band, we don't want to contaminate the field. For the bypass, in an open procedure, the gallbladder is right there, and it quite often will be just taken out at the same time. But when we are performing laparoscopic surgery, it's been studied and shown that it adds complexity to the procedure and actually increases the risk. That if you take the gallbladder out, if you need to take it out later, it's a safer operation to do at a later time. So that's the rationale that we follow on that. Hernias can happen, as I mentioned, after surgery, after any operation where we're going through the abdominal wall. Emotional stress, adjustment with family and friends, and compulsive social behaviors can happen. And these can be a real challenge, especially the first couple of years, but even in later years, even skinny people compensate with food. We celebrate as a society with food. We console ourselves with food. When we're lonely or bored, we eat. And this is true of skinny people as well. Well, sometimes people find those, if food is sort of taken away as an ability, a coping mechanism, that they can find other behaviors that make up for that are not really good behaviors. Gambling, drinking alcohol, uncontrolled sexual behavior can definitely happen. They're not common, but they do happen often enough, and we do see them occasionally where people need to have intervention or interact with a professional, go into treatment. And we just mainly urge you to recognize them if they're happening early, so that you don't have something tear up your life. Medications also need to be adjusted. There's no real description in the pharmacology literature of a medication actually being malabsorbed with these operations, as in needing truly a different amount of the medication, but in terms of the way it gets through the pouch or through the band, that definitely is an issue for the pills that can't be crushed. You need to change to a crushable form of a pill. Usually that means if you're taking a once-a-day pill, that you go to a 3 or 4 time a day version of that pill that's crushable. And just to be aware of that. And certainly the size of some pills can be an issue for people as well. The other thing on that for medications is for people to avoid aspirin or aspirin relative pills like ibuprofen and Aleve. That can be a real issue for people with arthritis, with a gastric bypass especially. That can lead to increased ulcer risk. Now, short-term burst of those things is not as big an issue, and some people we do have go on a relevant long-term, but they are aware of that additional risk that they're taking. We mentioned this before, restarting is possible after a relapse. The tool's not automatic. If you walk away from it, if you put it down, most people do not regain all their weight, but certainly you can be at a worse weight than what you'd like to be at. So restarting really is possible. We bring you in, get you back doing journaling of your food with a dietitian, talk with a counselor or psychologist about stressors in your life, get you on an exercise program, especially with exercise so that you're feeling full. Exercise and activity really helps you feel full after a meal and avoid that snackiness that so many of us get. And also to burn off some calories and build some muscle mass that doesn't hurt also. Also to remember that the tool can malfunction or break, especially with the older techniques as I discussed previously.